Hello, my name is Jayla Aldridge, and I will be doing a topic of vaccines and the eradication of smallpox. So, some background information. Smallpox is an ancient and contagious disease caused by the variola virus. It has existed for over 3,000 years, and transmission can be done via inhalation or contact with an infected person. The symptoms include fever, rash, and the well-known pustules that occur all over an infected person's body, and there's a 30% mortality rate. And because of this, 300 million people died of the disease in the 20th century. Survivors, however, have lifelong immunity, and 5 to 9% of cases overall developed ocular problems. There's no treatment for smallpox, only prevention via the vaccine. But even so, WHO declared smallpox eradicated in 1980. The current situation. As they were trying to eradicate smallpox, one of their strengths that they had was that inoculation and variolation gave rise to an effective vaccine that was already in place. A weakness was that there's no cure or effective, well-established treatment for those infected, so they would just have to wait and see, and in turn spread the virus. An opportunity was the creation. It was an opportunity to create a better system of communication when it comes to disease control and tracking, which is very necessary when trying to do an eradication effort on a global scale. However, the threat was that this system wasn't already in place, and because of this, there was a lack of cases reported, with an estimated only 1 in 100 cases reported. There was also a lack of funds for distribution. The contribution from other countries was not there. Vaccine donations and personnel were very much needed. Core issues. With such a deadly virus such as smallpox, with no established cure, talk of biological warfare was brought into discussion. And smallpox itself has been used in the French and Indian War in order to weaken their forces as the first form of biological warfare. The Second World War itself was also causing an increase in cases, along with traveling and trade. And as I said before, the lack of cases reported due to poor infrastructure and trained personnel was also causing an issue. The environment also posed a threat, as well as transportation of the vaccine and coordination with Africa, India, and Latin America, and other continents and countries with delocalized communities. There was also tropical medicine versus the bifurcated needle, whereas tropical medicine, when these policies and vaccinations were trying to be instituted on all of these communities, it could be seen as repressive, especially in terms of their own local and traditional healers. Alternatives. Via the health belief model, one approach could be that train them in proper prevention techniques, make them aware of the smallpox virus, teach them how to protect themselves, and what to do and who to contact if they are in contact with a possible case. A second approach would be to develop stricter guidelines for traveling and trade via different countries and vaccinating before traveling. One recommendation is to begin developing those proper medical infrastructures and surveillance, proper communication along these different countries and communities, training the people of the community in surveillance and how to spot and make records of smallpox cases. The second recommendation would be to have the government in each of these communities be very transparent about outbreaks and cases within the area, and have each government obtain its own personal eradication team. Now, the action plan should, that, as I said before, have each country have its own eradication team, but have one central eradication team that is able to obtain information from all these eradication teams and distribute it all over the world in countries. A goal should be made by 2021 to have an educated plan for people on what to do when an outbreak occurs, who to contact, and how to protect yourself. And by 2025, we'll all be implementing it, protecting ourselves and knowing what to do when an outbreak occurs. In my personal opinion, considering the times, it was a good effort. For cases like this, it really emphasizes the lack of communication and connection between health facilities around the world. In cases like the SARS epidemic in Canada, SARS has no proper protocol for identifying the disease and separating it from pneumonia, so it really is based on case definitions. And with case definitions, they're centered around the history of the infected person, who they've been in contact with, where they've traveled. And if Canada isn't aware of what's going on around the world, like they weren't with East Asia, it could cause a lot of problems and an outbreak could even occur. So we need to work on being very open and visible and communicating with everyone around the world and being transparent about the issues this could pose on everyone so we can all learn and be better for it.